It is no secret that infertility treatments such as IVF are considered inaccessible to people due to their extravagant cost. Yet to Black women, something as seemingly simple as giving birth to a child naturally is less accessible. It is statistically proven that Black women are 3 to 4 times more likely to die during childbirth than white women. Rusa Tikkanen and others in their study Maternal Mortality and Maternity Care in the U.S. and 10 other high-income countries found that in comparison to other high-income countries, the U.S. had the highest maternal mortality rate in 2018. In contrast to France's 8.7 maternal deaths per 100,000 live births, the U.S. experienced 17.4 maternal deaths per 100,000 live births. The CDC reported that for non-Hispanic Black women, that rate increased to 37.3 maternal deaths per 100,000 live births in the U.S. in 2018. Now, you may be wondering, where does this disparity come from? My goal today is to help clarify the source of that disparity and how it affects society today. Good afternoon. My name is Mattie Cieplak, and today I will be examining how Black women have not had equal access to reproductive rights since the beginning of modern gynecology due to medical racism. Medical racism is exactly what it sounds like: prejudice within the healthcare system against someone because of their race. To understand the origins of medical racism and how it connects to reproductive rights, we must first take a look at the time of slavery, in which Black women first lost bodily autonomy and were seen as property. Harriet Washington, in her work Medical Apartheid, does a phenomenal job of examining reproductive rights as a subset of medical racism, but also medical racism as a whole. Washington explores ideas such as malingering, which is the concept that Black people made up their illnesses in order to get out of work during slavery, and the fact that some scientific theorists believe that because Black people were a different race, that made them a different and subsequently inferior species altogether. Washington explains how these concepts were used as a justification for scientific racism, which Washington describes as being negative reactions to Blacks' appearance, historical writings, racial descriptions from antiquity, natural scientists' endless and largely fictional catalogs of racial traits, and biblical interpretations. Essentially, what we as an audience can take away from scientific racism is that Black people were being blamed for their medical conditions and overall health simply due to their identity as slaves. Rather than consider the fact that Black people might have been experiencing poor health due to the poor working and living conditions of slavery, white people created an epistemology of ignorance. Philosopher Charles Mills, in his work The Racial Contract, defines an epistemology of ignorance, which I can paraphrase as being an inability to consider or understand knowledge or a worldview other than your own. White people would never listen to what slaves had to say during the time of slavery, so they did not perceive their slaves as being knowledgeable individuals, which subsequently led to the development of an epistemology of ignorance. Scientific racism, because it deals with white narrow-mindedness in terms of understanding their slaves' health and lack thereof, is an epistemology of ignorance. Seemingly, an epistemology of ignorance in the context of scientific racism has nothing to do with reproductive rights, yet just below the surface, it has everything to do with reproductive rights. Dr. J. Marion Sims, also known as the father of modern gynecology, gained notoriety for being able to cure a condition called vesicovaginal fistula, as explained in the NPR podcast Remembering Anarcha, Lucy, and Betsy, the mothers of modern gynecology. In order to find a cure for that disease, Sims first needed to find subjects that needed to be cured. He found those subjects within Black women who were slaves, 3 of which were distinctly named: Anarcha, Lucy, and Betsy. Chapter 2 of Medical Apartheid, Southern Wonders delves into the different types of experiments Sims performed. Washington begins by characterizing Sims as revered as women's benefactor, although he conducted years of nightmarishly painful and degrading experiments without anesthesia or consent on a group of slave women. Washington then tracks the timeline of Sims' experiments. He began by treating newborn slaves for neonatal tetany. Rather than look for the real cause of this condition, Sims took to blaming the mothers of the babies. He saw the filthy environment that they were being born in as a result of the moral and intellectual failures, rather than the fault of the slave masters who kept these slaves in the poor conditions. Once Sims was able to diagnose these infants with neonatal tetany, he actually led to more death than survival due to his misunderstanding of how to treat the condition. Washington writes that the tetany was actually the result of severe calcium, magnesium, and vitamin D deficiency caused by chronic malnutrition. But Sims was erroneously convinced that it was caused by the displacement of skull bones during birth. To paraphrase Washington, following birth, babies would be taken away from their mothers for Sims to perform surgeries on their skulls, which ultimately would lead to their death. Again, Washington describes this death would be blamed on the mother of the child, rather than Sims, who performed the wrong procedure to begin with. Sims' transition point to venturing into gynecology occurred after he bought 17 female slaves to experiment on, including Anarcha. Washington documents that the real moment of revelation was when Anarcha went into labor. Washington goes on to say that following 3 days of labor, Sims was brought in to deliver Anarcha's baby. After the baby was born, it passed away, and then Anarcha started experiencing the symptoms of vesicovaginal fistula. Washington distinguishes these symptoms. Her torn vagina began eroding, and she was left with openings between the remains of her vagina and her bladder and her rectum. What Sims was unable to know, Washington indicates, was that Anarcha was at a higher risk of developing vesicovaginal fistula. The condition is a result of the traumatic birth, and between her young age, Sims' inaccurate use of forceps to help her give birth, and her malnutrition, Anarcha had multiple circumstances that made her more susceptible to the disease. Anarcha was left in a constant condition of pain due to the vesicovaginal fistula, but Washington notes that what interested Sims about her condition was that she was unable to work. Sims purchased 11 female slaves to specifically experiment about vesicovaginal fistula on in order to understand and cure the disease. These experiments are the first documented incident of medical racism intersecting with reproductive rights, thus creating reproductive injustice. Reproductive justice, the inverse of reproductive injustice, is the term created by Sister Song Women of Color Reproductive Justice Collective, and is the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. Sim facilitated the circumstances of reproductive injustice by not allowing the women he experimented on to have bodily autonomy by taking away their right to give consent. Moreover, although Sims was eventually successful in curing vesicovaginal fistula, Washington emphasizes that it was not done without harm to his subjects. Sims paid no attention to the value of modesty, an important quality during that time, in reference to black women, and violated their privacy by looking at their genitals and exposing them to everyone who was watching their surgeries, as well as ignored the fact that subjects of his experiments experienced extreme pain during his surgeries. These women were nothing more than means to an end for Sims, property he had purchased in order to gain success. Now that the origins of reproductive injustice have been identified, we can take a look at how it still endures within society today. Zakiya Luker and Kristen Luker in Reproductive Justice identify the different forms of reproductive injustice within society today, which include government interference with abortion and contraceptive rights, the difficulty to gain access to infertility treatments, cultural shunning of parental figures outside of the typical family unit, and the overall termination of parental rights from those who are deemed unfit by the state. Reproductive rights, which Luna and Luker identify as being focused mostly on abortion, came about during the 19th century when native white births were down. And immigrants and women of color were encouraged to use contraceptives or get an abortion after becoming pregnant. American white women had abortion and contraception access taken away from them to increase the amount of children they were having. Reproductive justice grew out of reproductive rights as a result of a lack of focus on the ability for women of color to choose whether or not they wanted to have a child. Luna and Luker explain that for those who do not want to have a child, access to abortion and contraceptives is vital. However, for those that do want to have a child, Luna and Luker distinguish two problem areas: the criminalization of reproduction and the lack of access to assistive reproductive technology, or ART. The criminalization of reproduction occurred following the beginning of the war on drugs, when crack babies were a phenomenon taking the world by storm. Luna and Luker disclosed that an attempt was made to identify women who had behavior that could be considered damaging to their fetuses. Luna and Luker reveal that mothers who gave birth in public hospitals were more likely to be subjected to random drug tests than women who gave birth in private hospitals. Luna and Luker write that the idea that a woman who would have freedom from interference of the government is untrue. As for assistive reproductive technology, or ART, infertility treatments are designed to perpetuate a certain type of family. Luna and Luker acknowledge that wealthy, white, heterosexual couples do not face questions about the usage of ART, while poor women, non-native speakers, and women of color often find barriers to receiving official diagnosis of infertility, let alone treatment. Being poor becomes a perfectly reasonable explanation to not have children, and although it is perfectly legal to use insurance money in order to pay for ART, people note that mothers who choose to do so are often regarded as bad mothers. Overall, Luna and Luker communicate that anyone outside of the typical family unit experiences difficulty to gain access to ART, whether it is people with disabilities, prisoners, HIV positive, single women, or same-sex couples. The third component to reproductive justice, as Luna and Luker describe it to be, is the right to parent with dignity. The obstacles that Luna and Luker find in this component deal with the disrespect when it comes to hearing the wishes of pregnant women, as well as the effects of the criminal justice system on families. Luna and Luker address that women of color are more likely to receive medical interventions in their birth compared to other women, such as forced cesarean birth. Additionally, Luna and Luker admit that criminal justice system, among other structural issues, has a clear inability to properly care for pregnant women and women who become parents in prison. Incarcerated women often end up shackled, which is a dangerous practice for both the mother and the baby, and for women who give birth in prison, parental rights are immediately terminated. The fact that women of color face difficulty in their response to their choice to not have a child, and how they choose to parent that child causes them to be the focus of reproductive justice. But is reproductive injustice even an issue in today's woke society, especially after the summer of 2020? In response to that question, we need look no further than Texas SB number 8, the Texas Heartbeat Bill, which took effect on September 1st, 2021. The bill is described as an act relating to abortion, including abortions after detection of an unborn child's heartbeat, and essentially takes away the woman's right to have an abortion after the detection of a fetal heartbeat. A violation of both reproductive rights and reproductive justice in context of the decision not to have a child, this most recent example demonstrates that these are still extremely relevant issues. Yet we can also examine examples involving the right to have a child and the right to parent with dignity. In 2018, Linda Villarosa, in the New York Times article, Why America's Black Mothers and Babies Are in a Life or Death Crisis, addresses the pregnancy of Simone Landrum, who is pregnant with her third child in 2016. Villarosa writes that Landrum sensed something was off about the pregnancy in comparison to her previous two, but attributed it to stress resulting from an abusive relationship with the father of her child. However, based on the combined symptoms of excessive fatigue, swelling of the hands and feet, high blood pressure, and headaches, Villarosa examines that it was likely that Landrum was suffering from preeclampsia, a sometimes deadly pregnancy condition. Landrum ended up going into labor early, and once she arrived at the hospital, doctors discovered her placenta had separated from her uterine wall. Villarosa goes on to say that Landrum's third baby, Harmony, was born stillborn as a result of lack of care of Landrum's medical condition. Doctors failed Landrum, Villarosa notes, when they ignored the fact that Black women have a higher tendency to develop life-threatening conditions during pregnancy. Villarosa recognizes that the tendency arises from a physiological sense of stress that Black women experience, which public health researcher Arlene Geronimus calls weathering. In NPR's article making the case that discrimination is bad for your health, Jean Demby interviews Geronimus about the science behind weathering. Geronimus, after being questioned by Demby, explains that weathering was meant to evoke a sense of erosion by constant stress, the ways that marginalized people in their communities coped with the drumbeat of big and small stressors that marked their lives. Geronimus explains that weathering leads to a health vulnerability. This vulnerability, Geronimus notes, means that Black women have their healthiest pregnancy during their teens in comparison to their mid-20s, like white women. Once Black women even wait a few years beyond their teens, the risk of developing a life-threatening condition during pregnancy increases tremendously due to weathering. Geronimus even mentions that no Black person, no matter their socioeconomic status, overall health, gender, or age, is immune to weathering. Even those who are considered respected in public society can fall victim to reproductive injustice. Take the birth of Serena Williams' daughter. P.R. Lockhart writes about the complications and lack of medical attention Williams faced in the Vox article, What Serena Williams' Scary Childbirth Stories Says About Medical Treatment of Black Women. Williams had already given birth to her daughter when she started experiencing physical complications, Lockhart writes. When Williams recognized the symptoms of a pulmonary embolism, which she had already experienced before, Lockhart writes that she immediately went to talk to a nurse about receiving treatment. Lockhart goes on to say that not only did the nurse ignore the treatment that Williams had requested, but proceeded to prescribe her a different treatment altogether. This error in judgment led to Williams' pulmonary embolism becoming more severe and ultimately caused her C-section wound to rupture and a hematoma to develop in her abdomen due to blood thinners that she had to take. Not only did this experience affect Williams' initial ability to parent, as Lockhart indicates that she ended up on bed rest for 6 weeks after birth, but in general indicated a belief in a lack of competency for Black women. So we've taken a comprehensive look at where reproductive justice comes from, all the way back to the time of slavery. Where do we go from here? I honestly have no answer. It's frustrating as a woman who hopes to start my own family someday to see this reality play out. It's frustrating as a white woman to be able to acknowledge the privilege that I have, but also acknowledge the fact that women in my own family have had experiences in which doctors have undermined them and put their lives at risk because of it. I cannot imagine advocating for yourself as a patient in a circumstance in which the odds are statistically against you. Thinking of someone like Serena Williams, I see a strong, amazing female athlete whose $24.99 Wilson Serena tennis racket was the first one I ever owned. The experience Williams went through does not invalidate that image to me. In fact, it strengthens it. However, the fact that this occurred in the first place is infuriating. Medical racism is certainly alive today, unfortunately, and it affects people of color of all ages, especially Black women. Professionals in the medical field need to have a sense of accountability in the ways in which they fall short in treating their patients, especially women of color, in order to move forward and create a healthier future. Thank you.